Studies published in the Journal of the American Headache Society state that up to 50% of people have head, neck, or facial pain. Headaches, including tension, stress, and even true migraine, cannot be diagnosed by X-rays, CAT scans, blood tests, and even MRIs. Therefore, most treatment is directed at symptoms as opposed to the cause. Clinical evidence conservatively estimates that at least 40 million people's head, neck, and facial pain or dental damage may be caused by occlusal interference. But identifying pain due to occlusal interference can be both difficult and time-consuming for even a highly trained doctor, so this condition often goes undiagnosed or misdiagnosed. The BestBite Discluder is unique in that it is based on a 50-year-old proven methodology to help and treat pain caused by occlusal interference.
I started getting headaches about 6 years ago. At first, maybe once or twice a month, but over the years, they've gotten much worse. The pain can be on the side of my head, or sometimes around the ear, or sometimes it can start at the top of my head and then just radiate down my neck. Lately, I've been getting as many as 2 or 3 a week that are so painful I have to stop what I'm doing and even leave work. At first, I went to my doctor, and he ordered X-rays and blood tests, which didn't show anything. So he sent me to a neurologist, and he ordered an MRI, which also didn't show anything. When nobody could find anything, they told me that I had some sort of migraine or tension headache. I've tried everything to help control the pain. I've gone to a chiropractor for over a year. I even tried acupuncture. I've taken everything from ibuprofen to prescription drugs, and I need to do something else because I know taking all these painkillers is not the answer.
The jaw is attached to the skull by the most complicated joints in the body. They are the only joints that move in 3 dimensions. The only pair of joints where both the left and right have to work together, and the only joints whose ultimate position is determined not by bones and muscles, but by the teeth. The jaw is a mechanical lever. In order to operate properly, it must have a stable fulcrum. If the teeth pull the jaw out of the socket, it destabilizes the jaw joint, stressing the jaw muscles and possibly causing pain that cannot be diagnosed by conventional medical tests. Muscle contraction pain can radiate and refer to other areas of the head, neck, and face with varying intensity and frequency. A landmark study by Dr. Janet Travell demonstrated that the patient's perception of head, neck, and facial pain was usually distant from the location of the pain stimulus. That is why pain from occlusal interference is often referred to as medicine's great imposter. Many people unconsciously clench or grind their teeth in response to the conflict between the teeth and jaw joints, not because of stress. Because tooth clenching and grinding cannot even the bite, it continues indefinitely. Dental consequences of tooth clenching and grinding include damage to the jaw joint, and biomechanical dental disease, including ab fractures, gum recession, broken, chipped, and worn teeth. Treating the pain of occlusal interference is simple. Center the jaw and allow the muscles to release. This is not a forced position. It is where the jaw joint would naturally go if the teeth would let it. This is not easy because every time the patient closes their mouth to bite or swallow, the teeth pull the jaw joint out of the socket, causing muscles to cramp even more. The BestBite Discluder addresses the pain for what it is, a biomechanical problem. The patented design of the BestBite Discluder incorporates a universal discluding element that adapts easily to the patient's upper front teeth using our custom liner material. The contact area of the lower incisor teeth on the BestBite Discluder is on average 3.5 inches from the center of the jaw joints. The angle of the glenoid fossa is typically no less than 25 degrees. The patented 8-degree angle on the BestBite Discluder will gently facilitate the condyle's upward and backward movement to a centered position. Let's take a look at a typical patient visit.
So, do you have any pain right now?
Yeah, it hurts here and back here.
And if you had to rate the pain from 1 to 10, with 10 being severe and 1 being perfectly comfortable, where are you right now?
Right now, I'd say it's about a 7, but it can be as bad as a 9 or a 10.
So what I'm going to do is I'm going to put my BestBite discluder in your mouth and let that help tell us if your bite is part of the problem.
Okay.
Open your mouth a little bit, please. So all you have to do is just tap your teeth up and down as we slide this in. Go ahead and just let your jaw relax a little bit now. Okay, I want you to keep going while I let go, okay?
Mm-hmm.
Okay. Does that feel any different now?
Yeah, it feels looser.
Okay, let's keep tapping now. Do you have any discomfort right now?
Not really. It's kind of gone away.
From 1 to 10, where are you now?
2, 1.
Okay. Let's take this out. And just close your teeth together and squeeze up a bit. Swallow a couple of times. And tell me how you feel now.
Yeah, it's starting to come back. I can feel the pressure starting to build up.
And from 1 to 10, as far as pain?
About a 4 or a 5.
Okay, let's put this back in now. Let's tap up and down again. How are you feeling now?
It's gone again.
It's great. Let's take this out. So what do you think?
I can't believe it. I've had these headaches for 6 years, and in 15 seconds, they're gone. I just can't believe how fast they went away. Do I have to wear this thing all the time or sleep with it?
No. What this has proven is that your bite is the source of the pain. So all we have to do is eliminate the conflict between your teeth and your jaw joints, and that will take away the pain. And you can use a discluder between visits to manage any discomfort you might have in between.
Great.
The BestBite discluder always works. If it takes the pain away, then the doctor and patient can feel confident that the bite is part of the problem. If it does not take the pain away, the bite is probably not the source of the pain. By helping to determine who should or should not be treated, BestBite helps to ensure a successful result.
My headaches, my facial pain, my TMJ is something that I've lived with since high school. But I didn't know that it was TMJ. My mother had taken me to the family physician, who had referred me to the allergist, and I then also went to the eye doctor because it was probably eye strain with my facial pain. And I believed this.
2.5 years ago, I began to notice an incredible discomfort in my jaw and actually some numbness. And I didn't think very much about it. I went to see my dentist, who looked at me and said, I think you should relax. It's probably something psychological. And it kept getting worse and worse. And I kept going back to him and saying, look, it's got to be something more. And he looked at me and he said, well, let me just do a little bit of filing. And he did a little bit of filing and suggested that I see a therapist and begin to do some type of relaxation. It kept getting worse. And so I went to my doctor, who recommended that I go to a neurologist, who recommended that I go to an ENT person, who recommended that I go to yet another dentist. who then put a bite plate, a night retainer, and suggested that I get my whole mouth redone.
It started, I would say, during high school. I would get them in the morning upon awakening, and then I would get them about 3 o'clock in the afternoon and in the evening every day. I would take Excedrin or some ibuprofen 2 to 3 times a day.
My TMJ was diagnosed with the discluder. It was shocking to me because I couldn't believe that it could be this easy for me, that I didn't have to work, that I didn't have to do anything that was painful, yet it was taking my pain away.
And immediately, after being fitted for the discluder, once it was placed in my mouth, I began to feel a sense of comfort that I had really not experienced for over 2 years.
He put it in my mouth, and within seconds, I felt relief through my joints and under my eyes. It went from like pain being a 10 to like a 4.
And Dr. Simon has adjusted my bite. I don't have the facial pain. I don't have the headaches. It's a wonderful thing to be free of that.
And feel about as free as symptoms as I felt 3 years ago.
Because you live with this 10 years, and then all of a sudden, it's gone in 30 seconds with this little device about this large.
The BestBite Discluder is part of a proven system to help treat pain caused by occlusal interference, unlike other methodologies like drugs or dental tension suppression systems that only mask symptoms. The BestBite Discluder helps any head, neck, and facial pain doctor to determine if the patient's bite is the cause of their pain. By providing immediate pain relief, the BestBite Discluder allows the doctor and the patient to confidently proceed with safe and effective bite treatment. The BestBite Discluder can also be used between visits to manage discomfort. The BestBite Discluder is totally reversible. When being used correctly, there is no risk of damaging the teeth or the jaw joint. The BestBite Discluder, easy to use, rapid results, safe and effective.
There are many reasons why people get head, neck, or facial pain, and what we have to determine is your bite a factor in the pain that you're having? So in order to do that, we go through a 4-step diagnostic process. Step number 1 is there any evidence that you're clenching or grinding your teeth? Step number 2 is there conflict between your teeth and your jaw joints? In other words, when your teeth come together, because they fit together only one way, do your teeth literally pull your jaw joints out of the socket? Number 3, is there any corresponding muscle soreness that goes along with that? And number 4, if all those are true, will the BestBite Discluder take some or all of your pain away? Because if it does, and all those steps we can connect all the dots with all those steps, that means that your bite is the source of the pain. Does that make sense?
Yeah.
Okay. So if we look at your teeth first, what I can see is there's some wear on the biting edges of your teeth in the back, number 1. And number 2, I can see some recession of your gums. So I know for sure that you're clenching or grinding your teeth. Even if you're not aware of it, the evidence is there. I can see that.
Okay.
Number 2 question is, let's see if there's a conflict between your teeth and your jaw joints. So if you tip your head up a little bit, and we let your jaw relax now, what I want to do is I want to let your jaw joints center. So your jaw joints are up here in front of your ear. And so if you just relax your jaw a little bit, and just slowly open and close your mouth. What I want you to do is I want you just to very slowly close until you just barely touch, and then tell me if one side touches before the other, okay? Just go ahead and do it slowly like a feather. Just touch very lightly and make a little noise so I know you're touching. Okay.
Yeah.
Which side's touching first?
Right.
Okay, good. Let's try it one more time. Okay, just slowly close so you just barely touch. Same place?
Yeah.
Okay. So now what happens is when your jaw joints are centered, you're just touching on the right side. Next step is to see what happens when your teeth go all the way together. Okay, so tip your head up a little bit and just let your jaw relax a little bit and close so you just barely touch. Stop when you touch and hold right there for a minute. Touching now?
Mm-hmm.
Okay, then squeeze together. Feel your teeth shift?
Mm-hmm.
Try it one more time, close so you just touch. And then squeeze together. What happens is when you close your teeth together, you just touch on the right-hand side. And then in order for all your teeth to touch, you feel your jaw shifts over to the left and then back to the right.
Yeah.
So when it does that, it pulls your jaws out of the socket because the jaws have to go along with your teeth. So there's obviously a conflict between your teeth and your jaw joints.
Right.
Okay. Now, the next thing to do is we'll check the jaw muscles to see if there's any corresponding soreness. So let's check the masseter muscles. Is there any soreness in here?
A little bit, yeah.
Okay, not much. Okay. And what about up here around your temples?
It's a little sore, yeah.
A little sore? And on both sides?
Yeah.
Okay. And what about down the back of your neck? Any soreness there?
It's slight, yeah, a little.
Not much, though, really. Okay. Now, the last muscle I want to check, which is the most important one, is called the lateral pterygoid muscle, and that's inside your mouth.
Okay.
So if you open your mouth a little bit now, close your mouth a little bit, and how's that right up in here?
Oh, that hurts.
Really?
Mm-hmm.
Okay. That's pretty sore. Let's try the other side.
Oh, yeah.
One side worse than the other? Or
No, they're both
the same?
pretty sore.
No. Most people think I'm poking them pretty hard, so I want to borrow your finger for a minute.
Okay.
And I want you to put your finger in where mine was and just test it and see how that feels. Right in the back up towards your ear.
Oh.
So you didn't have to take much pressure to cause that pain.
No.
So that tells us that now the third step of the corresponding muscle soreness has been met. The last thing to do is to determine is if the BestBite discluder will relieve some or all of the pain, and that will connect all the dots.
Okay.
Okay, so let's try that now. Tip your head up a little bit. Now, remember your jaw joints want to be centered, so what the BestBite discluder will do is it will prevent your back teeth from throwing your jaw out of the socket and allow your jaw joints to center, and at the same time, take any muscle spasm away.
Okay.
Where is it hurting right now? If you could just point to where you're feeling it.
Well, I have a headache. It hurts here and a little bit back here.
And if you had to rate it from 1 to 10, with 1 being no pain at all and 10 being a lot of pain?
I would say it's about a 7 now.
Right now it's about a 7?
Yeah.
Is it worse on one side than the other?
Yeah, it's more over here.
Okay. So let's use the BestBite discluder. Open your mouth a little bit, please. I will slide this into your mouth. And tip your head up a little bit more. And just let your jaw relax a little bit now. Good. So all you want to do is just slowly close your teeth up and down. What this is doing is it's letting your jaw joints center without your teeth having the ability to pull the jaw out of the socket.
Mm-hmm.
And as your jaw joints center, the muscles will release. How are you feeling now?
It feels better.
Okay. Do you have any discomfort right now?
No, not really.
From 1 to 10, where are you right now?
About a 2 or 1.
2. Okay. So it's mostly gone.
Yeah.
Okay. Okay, let's take this out for a minute now. Now, if you close your teeth up together and swallow a couple of times, clench up a little bit. How are you feeling now?
It's starting to come back. I can feel the pressure building up again.
Starting to tighten up a little bit?
Yeah.
Okay, and from 1 to 10 now?
About a 4 or 5.
Okay. Open mouth a little bit now. Let's put this back in again. Just let your jaw relax a little bit now. How are you doing now?
It's gone again.
Gone again? Okay. Now what I want you to do is, while this is in your mouth, I want you to reach up like the way you did a moment ago, and just test that muscle again.
Okay. Oh. It feels much better.
So what we've done is we've gone through the 4-step process to see what part of the head, neck, or facial pain that you have is being contributed to by your bite. We know that you're clenching and grinding your teeth because we can see that evidence. We can tell that there's a lot of muscle soreness because you can feel that. And number 3, we can see there's a conflict, and you can feel that as well, between your teeth, where your teeth force your jaw to go, where your jaw would like to go.
Yeah.
And the last thing that connects all the dots is that the BestBite Discluder takes the pain away. So now we know for sure that your bite's the problem. Based on the fact that this is taking the pain away, we know that by fixing your bite, we can get an equal response in terms of taking the pain away. And you can use a Discluder between visits to manage any discomfort you might have in between.
Great.